Hello everyone. Today we'll discuss about one of the most commonest thing which people find and complain for the dentist is regarding mouth ulcers. Now, mouth ulcers is one of the most common and most painful event which most of us suffer from, be it a normal person or be it any profession, but especially professions like medicos, professions like athletes, and exam going students. A lot of people suffer from a condition called as oral ulcers, mouth ulcers, which is medically called as stomatitis. Now, what are basically mouth ulcers? Now, mouth ulcers are nothing but painful sores. What you observe is they are painful sores that appear inside your mouth, and they're usually red, and they have got surrounding by a very important clinical finding of a yellowish border. They are different from cold sores, which is very important because cold sores is something which is caused by a virus. Cold sores is nothing but caused by a herpes virus. Now, what are the main common causes for a mouth ulcers? Now, usually mouth ulcers can be caused because of the damage or which is caused by biting the cheek or tongue or by a sharp tooth or by an ill-fitting denture or by a very aggressive brushing or by a very strong firm maybe a bristle of a new brush, and these ulcers are called as a traumatic ulcer. So one of the most commonest reason for an ulcer is a trauma. It's called as traumatic ulcers, and if these ulcers are multiple in number and they are recurrent in nature, they come back again after 2 weeks or 3 weeks, then those types of ulcers are technically called as recurrent aphthous stomatitis. That means recurring ulcers. Now, how will you know that you have a traumatic ulcer? Traumatic ulcers are usually on their own, and they are mm, uh, mostly, I could say, that these ulcers are next to the cause of the damage. That means they are absolutely adjacent to the source of the problem. And once you remove the problem or once you remove the source of injury, the ulcer subsides in few days. Like you can see ulcer which is there on the buccal mucosa, which is called as a cheek, and then you can see the source of an ulcer could be a cheek bite or can be a sharp tooth. So either the tooth has got a sharp edge or a cheek bite or a improper restoration, unfinished restoration, which can lead to the trauma, and then the trauma subsides. Maybe you visit a dentist and then he visualizes or diagnoses the trauma or the reason for the trauma and resolves the problem, and then you will automatically lead into the progressive resolution of the ulcer. Okay. Then, what are the signs of a recurrent aphthous stomatitis? Now, your recurrent aphthous stomatitis or recurrent ulcers are very common, and they are seen otherwise in healthy people, young people, and the cause is not known and but is not infectious and unlikely to be inherited. So they have no relation to be on inheritance way, but then they can happen otherwise in a healthy individual, a young child, a young adult, or an adult, and the cause is not known, but you can attribute the causes to malnutrition, you can attribute the causes to maybe some infection or anything as such, but then nothing specific. But people say that most of the times is recurrent ulcers is also because of the anxiety and especially because of malnutrition or sometimes contributed by some drugs or some virus infections also. Now these recurrent ulcers could be of three forms. The first form is a minor ulcer, which is called as you can say a minor or small ulcer, which are very common. They appear in your cheek, on your lips, tongue, gums, and more rarely on the roof of the mouth or palate. And most of these ulcers are the size of a top of a pencil, very small, and can sometimes come in clusters. They can be 4 to 6 at one time, and they are not more than 2 or 3 millimeter size, and then they resolve in a week time. That is recurrent aphthous ulcers, which are minor in nature. You also come across sometimes major. Recurrent aphthous major. These are large ulcers, very large, as you are seeing on a picture, quite 5 to 6 and they last for 2 to 3 weeks. Absolutely painful, very symptomatic to the patient, and takes maybe 3 to 4 weeks for it to subside. Then what are the less common causes of mouth ulcers? Those are the rare causes is herpes simplex is less common cause, but then most commonly seen in children, young adults, very common seen in children, and very more commonly seen not only in the oral cavity but also around the oral cavity on your lips, especially, and that is one of the major contributing factor in less common causes of mouth ulcers. Mouth ulcers can be caused by anemia, very commonly blood viscoses, skin issues, gastrointestinal problems, and mucocutaneous. That means ulcers are also seen not only in the mouth but also in other parts of your body, especially your genitalia. So you need to be very, very clear and prompt in revealing the history to your doctor if you want the exact and precise treatment for your ulcers, because ulcers not only happen in mouth, sometimes they're associated with ulcers or lesions which are seen on your skin, in your eye mucosa, which is called as conjunctiva, in your nasal mucosa, in your genital mucosa. So you have to be very, very careful and be very precise in giving a good history to your doctors when you have the ulcers involvement in your other parts of body other than your oral cavity or your mouth. You have got a lot of other things which are related to your gastrointestinal, related to your intestines, regarding so many things. So the history is important. Most of the times anemia, malnutrition, leukemia, so many things will lead to ulcers. And then herpes simplex is one of the most commonest ulcers which is seen in children. You can see these ulcers are minute, as I was mentioning you, very, very small, very, very minute, hundreds and clusters of ulcers. You can see on the roof of your mouth here, you can see on the floor of your tongue, on your ventral surface of your tongue. And these ulcers, as I said, will also involve your lip surface. This is called as ulcer crusting. This is a healing stage of an ulcer, which you see on more common on your lips, which is one of the very common advantage of, the commonest finding of these ulcers. One of the most peculiar, there are two things which I want to mention in this, in terms of herpetic ulcers, is always and mandatory that patients gives you the history of fever before the onset of ulcers. So it's always that the patient gives you the history of fever in children, fever of 2-3 days, followed by ulcers, and it is self-resolving. This is one of the most important point, one of the outstanding feature or a landmark feature of it is onset of fever, malaise, followed by ulcers, takes 1 week, subsides automatically, progressively, but it is recurrent sometimes if you're immunocompromised. But then these ulcers are to be considered because they can lead to ulcers in your brain, herpetic encephalitis, and herpetic conjunctivitis on your skin, and most important, when you touch these ulcers, so you can also find these ulcers on your fingers, on your. This is called a herpetic whitlow. This is also considered. So this is just a part one, just a briefing and introduction to ulcers. I will go into more details of the ulcers in the next part of the presentation. Thank you.